Hi, Namaste, Dr. KMK Reddy. Today we will discuss another topic, that is how far we should miss our medicines in treatment of high blood pressure. Means this is in technical terms called medical adherence to the treatment, also called compliance of the medication. So for anything, compliance is important, a positive compliance. Suppose if an individual is asked to take medication, so and so tablets for a control of blood pressure, is there a necessity to take these medicines every day? Is the question commonly being asked. So let us see, when there is a high blood pressure, means more than 140/90. So generally the normal blood pressure is 120/80. So anywhere between 120 to 140 is okay for a systolic blood pressure. In the same way, 80 to up to 90 is also okay for a diastolic blood pressure. So the blood pressure that is being recorded in adults as more than 140/90 is called high blood pressure. Okay, let us say if an individual has a blood pressure of 180/110, let us see. If an individual is having this type of blood pressure, they may have a very dangerous effect on brain, the heart, the kidney, and also the eye. So these are very important organs in the body that are being affected adversely if we don't manage the blood pressure normally. So to protect all these organs, we call it as a target organs. So to avoid target organ damage, to protect all these organs, the blood pressure needs to be controlled 24/7. It means if we give medicines today, the medicine works for today, not for tomorrow, naturally. So if we stop medicines, taking only for a few hours or a few days, or probably some people skip medicines, I don't say it is intentional, sometimes unintentionally or by forgetfulness, if they stop medicines for a day or two and once again they restart the medication, is it okay? That is the question most of the people ask me. But the answer I think you got by now. If we don't take medicine in a given day, our blood pressure may go out of control on that given day. What I mean to say, if we skip medicines frequently, probably we are giving a scope for our blood pressure to be uncontrolled, or it may go up and down. So when our blood pressure goes up and down, definitely it is more dangerous to the target organs. So to protect our target organs like brain, heart, kidney, eye, we need to use medication every day. The dangers of high blood pressure we all know, like sometimes people may throw a stroke in the brain, stroke in the heart, also sometimes have irreversible kidney damage, and also have some amount of ruptures in the retina or hemorrhages in the retina, that is in the eye. So to avoid all these complications, we need to use medication. So it is very simple. So if we don't want to have all these issues, all these complications of high blood pressure, we need to use medicines every day. There is no dispute in this. So if we skip medicine, we are inviting troubles. So how often we can skip? Absolutely no day we should skip the medicines. So not even a single day we should skip the medicines. That should be our every day, something like along with our diet, we need to take these medicines. Suppose if you have too many medicines to control the blood pressure, at times we do prescribe like 3 medicines, 4 medicines also at times. So all these medicines to be taken every day. Dear friends, this has to be remembered. It is not the one medicine that controls everybody's blood pressure. So there may be people, like I say, 30 to 35% of the people need more than 3 medicines. So whether it is in the form of combination or it is in the form of individual drugs, if somebody is taking all these things, they are supposed to take every day without missing. So now you tell me, you can answer easily and you can understand easily, is there a need for a strict adherence to stick on to the medicine schedule for control of the blood pressure? Answer is yes. So therefore, I clearly request all of you, whoever has been taking the medicines for control of blood pressure, they need to take medicine every day. No day should be free of medication until unless your doctor says. Sometimes probably if the blood pressure is too much under control, they sometimes to taper the drugs, they say you stop for a day or two. But generally 99.9% of the times the medication for high blood pressure has to be taken every day. You need to remember this issue to have a smooth control of blood pressure, and I also suggest you, whoever has been taking the high blood pressure medication, please suggest them they have to take medicines every day without skipping. And if we take medication every day, like months or years together, is it okay? Answer again, no. They need modification, sometimes the dosage modification, sometimes the side effects monitoring. All these things have to be done. That should be done with the consultation of your own physician or the cardiologist. That is a different topic. So please adhere to the medication very strictly. Take medicines every day. Very, very important thing. Remember this, follow this. If you like this video, please share this video with your friends and families to have a better normal blood pressure community for our normal blood pressure society for us. Thank you. హై బ్లడ్ ప్రెషర్ కోసం చాలామంది మందులు వాడుతూ ఉంటారు. ఈ మందుల్ని అప్పుడప్పుడు కొంతమంది ఉద్దేశపూర్వకంగా కాకపోయినా పొరపాటున మిస్ అయ్యే అవకాశం ఉంటుంది. మిస్ అయినప్పుడు చాలామంది భయపడతారు, కంగారు పడతారు, పానిక్ అవుతారు. ఇంకొకటి వేసుకోవాలన్నా, సాయంత్రం వేసుకోవచ్చా, పొద్దున వేసుకోవచ్చా, పొద్దున మిస్ అయితే సాయంకాలం వేసుకోవచ్చా అని ఇలా అడగడం సర్వసాధారణంగా వింటూ ఉంటాం. ఫ్రెండ్స్, ఒకటి మాత్రం వాస్తవం, ఎప్పుడైనా మెడిసిన్స్ యాజ్ పర్ ద షెడ్యూల్ తప్పనిసరిగా ప్రతిరోజు వాడాలి. ఎందుకనంటే హై బ్లడ్ ప్రెషర్ అనేది చాలా చాలా ప్రమాదకరమైనది. ఇది బ్రెయిన్ని, కిడ్నీని, హార్ట్ని, ఈ కన్నుని ఇబ్బంది పెడుతుంది. సో ఇవన్నీ నేను చెప్పిన ఆర్గాన్స్, ఆ అవయవాలు చాలా ముఖ్యమైన అవయవాలు కాబట్టి వీటి మీద డ్యామేజ్ జరగకుండా, ప్రమాదం జరగకుండా, బ్రెయిన్ స్ట్రోక్ కానీ, హార్ట్ స్ట్రోక్ కానీ, కిడ్నీ మీద డ్యామేజ్ కానీ జరగకుండా ఉండాలి అని అంటే తప్పనిసరిగా ప్రతిరోజు బీపీ మెడిసిన్ షెడ్యూల్ ప్రకారం వాడాలి. షెడ్యూల్ ప్రకారం వాడకపోతే ఈరోజు వేసుకున్న బీపీ ట్యాబ్లెట్ రేపటికి పనిచేయదు, రేపు వేసుకున్నది ఇంకొక రోజుకి పని చేయదు. ఏ రోజు వేసుకున్న బీపీ ట్యాబ్లెట్ ఆ రోజుకే పనిచేస్తుంది, మహా అంటే మర్నాడు పనిచేస్తుంది. కానీ 24/7 మాత్రం కంప్లీట్గా నెక్స్ట్ డే ఇవ్వదు. సో ఒక్కరోజు స్కిప్ అయినా కూడా బీపీ కంట్రోల్ తప్పవచ్చు, తప్పిన తర్వాత ప్రమాదం జరగవచ్చు. కాబట్టి ప్రమాదం జరగకుండా ఉండాలి, మన బీపీ మన కంట్రోల్లో ఉండాలి, ఆరోగ్యకరమైన జీవితాన్ని గడపాలి. బీపీ ఉన్నా కూడా అంటే తప్పనిసరిగా రోజువారీ మందులు వాడవలసిందే. ఈ విషయాన్ని మీరు అందరూ గుర్తుపెట్టుకోవాలి. నమస్తే, మీ KMK రెడ్డి.